Hi, my name is Afsar Sunesara. I'm a junior athletic training student here at Texas Lutheran University, and today I'm going to be demonstrating a slow reversal PNF strengthening technique on the hamstring muscle. So the PNF strengthening techniques are very beneficial to increase strength, flexibility, and the coordination of the neuromuscular system. And it's important that we apply an appropriate amount of pressure when performing these techniques because the muscle is stronger or weaker depending on the length that it's at, and that's demonstrated through the length tension curve. Also, the amount of reflex that's given off by the muscle is determined by the amount of pressure applied. It's also important that we have a smooth and fluid motion during the exercise so the muscle can contract in a smooth fashion. So first I'm going to ask Breauna, I'm going to show her passively that she's going to bring her heel to her butt just like this. And this is the exercise we're going to be performing today. And now I'm going to ask her to perform that movement on her own actively. Just like that, one more time. Good. And now I'm going to start applying resistance on the concentric portion and eccentric portion of the exercise. So with my left hand, I'm just going to stabilize her leg right here, put my right hand on her heel and her Achilles area, and ask her to go ahead and bring her heel to her butt. Good, 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 good. Quickly transition, and she's going to push, 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 push. Another rep. Good, 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 good there. And then push, 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 push. Just like that. We would usually do this in sets of 10, and usually it can be done in 3 sets of 10. Hello again. Now I'm going to be demonstrating the neuromuscular control exercise for core stability, and this is going to be demonstrating the quadruped exercise. Neuromuscular control exercises are targeted to constantly provide input and have reactive muscle activity, and that's because a neuromuscular control refers to efferent input or responses to an afferent input. And the patient is going to be experiencing more sensory and motor pathways, and that's going to result in more synapses being formed, and therefore increasing efficiency of transmission, and therefore increasing neuromuscular control. And this is going to help improve feedback control and proprioception. So here we are with the patient in position. She has her hands about shoulder width apart and her knees on the table also about shoulder width apart. The first progression of this exercise, I'm going to ask the patient to stabilize her core, keep everything tight, and then just lift one hand off the table and extend that way like this. Go ahead, just like that. So she'll do about 2 or 3 reps of this with alternating hands, just to demonstrate. Good. And now a progression for this would be extending the alternate leg and alternate hand at the same time. So Breauna, can you demonstrate again for a few reps? Just like that. And it's important to keep the core tight, and what I'm looking for as a clinician is to see if there's a lot of movement in her trunk, or if she's spiking her hip up at all while she's doing the exercise, or if this is uncomfortable to her.
Hello, my name is Breauna Gabriel, and I am a senior student here at Texas Lutheran University. And today I will be doing the diagonal 2 or D2 PNF technique on the upper extremity while also doing a slow reversal hold. So the purpose of this is to emphasize re-education of individual motor elements while also developing neuromuscular control, joint stability, and coordinated mobility. So the patient will begin laying supinated. The shoulder will be flexed, externally rotated, and abducted. The wrist radially deviated, the forearm supinated, and the fingers extended. Next, the fingers will flex, the wrists will ulnar deviate, pronation of the forearm, the shoulder will adduct, internally rotate, and extend. And then the fingers will extend, wrist will radially deviate, supination of the forearm, and the shoulder will flex, abduct, and externally rotate. And then I'll have the patient do it one more time. Flex the fingers, wrist ulnarly deviate, pronation of the forearm, shoulder adduct, internally rotate and extend. Fingers extend, radially deviate, supination of the forearm, shoulder flex, abduct, and externally rotate. Then I will have the patient go through the motion twice on their own. Go ahead. Good job. And back up. And one more time. Good. And back up. Good job. And then I will have the patient do it again, but then I will add resistance while he is going through the motions. So go ahead. And one more time. Good. And back up. Excellent. Is that it?
Yeah.
Okay. Normally, I would recommend doing this exercise with 3 sets of 10.
Hi, my name is Alexandria, and I'm a junior here at Texas Lutheran University. And I'm going to be demonstrating an exercise to improve balance and postural control followed by one progression. So this exercise is used to improve kinesthesia and proprioception for balance, to enhance balance. So our patients can begin by maintaining balance and standing on one foot, just like so, and trying to maintain a level pelvis. If the balance is kept without falling over or having extreme anterior or posterior sway, for 30 seconds, we will progress into standing on one foot on a foam mat to increase difficulty. And this conversion goes from static to semi-dynamic stabilization. So we're going to get the foam mat. And he's going to put 1 foot on it and then balance on this 1 foot for me for about 10 seconds. And try to maintain his balance for us. Afsar's not so good at it. And if he can maintain his balance for 3 sets of 30 seconds, we'll progress into the next section.